This week's Lady Boss started as a nurse and eventually became CEO of Edward-Elmhurst Health. Now she's spearheading Transformation PX, an initiative taking the stress out of healthcare. Please welcome Lou Mastro. Hi, Mary Lou.
Hi, Mary Lou. So glad to have you here.
Thank you. Happy to be here.
Yes, before we get into everything you do, what made you initially pursue healthcare as a profession?
So that's interesting. As a child, I always knew that I wanted to work in healthcare, and I'm the only person in my family who has gone into healthcare. Wow. And I went off to college to be a physical therapist, and in my freshman year, during the spring, I had a large emergent abdominal surgery, and I was in the hospital for a week. Oh. It was scary. My parents weren't there, and I was overwhelmed with the care that I got from the nurses and physicians, and at that point I decided I was going to be a nurse.
Wow.
They were so kind and compassionate. The other thing was my parents had to come in from out of town. This was a very small college town, and there was nowhere for them to stay, so they ended up staying in the home of one of the nurses.
Yeah, how do you go from nurse to CEO? And I want you to talk about Transformation PX too.
Okay, so I started working as a nurse, cardiovascular critical care, and I worked in 3 very large medical centers, and I got a phone call to interview at Edward Hospital in Naperville, and at the time it had a very poor reputation. It was small. I remember driving up for the interview, pulling into this gravel parking lot at this old dilapidated building and thinking, what am I doing here? But my former mentor was the CEO at the time, Pam Davis, and she convinced me to come take the job as Director of Cardiovascular Services. They didn't have any cardiovascular services, so we built up this phenomenal program in cardiology and now have this one of the largest, most impressive heart hospitals in the state. Thank you. And really, after that, it was just a process of every time an opportunity was presented, I had to take my fear and doubt, put it on the side, and just say yes. So I took risks. I did things that I never would have believed I could have done. And I remember getting the call to be the president of our psychiatric hospital, and my first thought was, heck no. But I said yes. I took the job and absolutely loved it. So I just kind of worked my way up the ladder, constantly saying yes, with a tremendous mentor who created opportunities.
I love what you said about putting fear to the side and taking risk. I feel like so many of us don't do that, and this is what happens when you do.
Yep.
Right,
yep.
You said yes, but you must have been doing something right for them to be asking, is what happened. But tell us about Transformation PX and how it works.
So Transformation PX is our vision to transform the healthcare experience to be safe, seamless, and personal. And healthcare is so far behind other industries. It's complicated, it's confusing. We're not as frictionless as people are used to in, for example, travel and banking and retail shopping. Healthcare is just harder to navigate. And so we have this very large initiative where we're working actually with our patients and families. We have had lots of focus groups to find out where their pain points are. And we had 75 patients actually record their journeys through the healthcare system. And we understood then where the major pain points are. And so we have teams that are addressing those pain points. And we're highly focused on trying to just be easy to access and convenient.
Right. Tell us a little bit more about EE Health.
EE Health is a comprehensive integrated delivery system in the western and southwestern suburbs. We have 8,000 employees, 1,700 physicians, and we operate out of 50 different sites. So we provide the spectrum of care from community partnerships, education, disease prevention, all the way through taking care of the very sickest of patients in the intensive care units. We have 3 hospitals, 2 medical hospitals, one in Naperville and one in Elmhurst, and a large psychiatric hospital.
Yeah, and I know that mental health is a big thing for you.
Mental health, I am very passionate about mental health. It's personal for me. I had depression and anxiety as a kid and never got professional help until I was in my 40s. And so I tried to manage it using a lot of unhealthy ways.
Right.
And the fact of the matter is 1 out of 5 people have a mental illness, and over the course of our lifetimes, half of us will experience some type of mental illness. And yet there is so much stigma and shame associated with mental illness that over 50% of adults and 70% of kids that need treatment don't get it.
Right.
And that's a tragedy because we know that treatment works, that we have medications and therapies and self-help tools that we can give people that can help them live more productive, meaningful lives.
Yeah, from a guy who lost a brother to suicide, I really appreciate what you're doing.
Sorry to hear that,
Thank
Ryan.
you. Thank you.
Thank you so much, Mary Lou, for being here.
I do want to say that we have a program called Mental Health First Aid. We're one of the largest providers of mental health first aid in the country. And it's an educational program that teaches lay people about mental illness and what to do to help someone. And I think that we have to change the dialogue. We have to start talking more about mental illness and you know, that there are treatments out there and what people can do to help others.
Yeah, it's about erasing the stigma for
It
sure.
really
And thank you for doing what you're doing.
Thank you.